Welcome to MATER MISERICORDIAE Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located on between Tom Mboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecologist services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to MATER Hospital CBD. We assure you of timely, efficient, and satisfactory services.
A very warm good morning, and thank you very much for joining this live discourse. We are set, as promised, bringing you this live discussion from our headquarters in real time, the chilly weather notwithstanding. My name is Sasha Elizabeth, and today we are set to discuss one of the world's oldest recognized conditions with records dating back to 4000 BCE, that is epilepsy or a seizure. So joining me in studio is Dr. Khalid Abdallah from MATER Misericordiae Hospital. Assalamu alaikum.
Wa alaikum salam.
So makbul.
Shukran.
All right, so thank you very much for making time for this discourse.
It's my pleasure. It's my pleasure to be here.
All right, the records are actually, it's the longest, one of the longest, that is epilepsy, and there are still a lot of fear, there's a lot of fear, a lot of social stigma, and of course the myths and misconceptions surrounding this condition. Yeah, so I hope we are set to walk this discussion.
Absolutely.
All right, I believe you are set on your end, dear viewer, and as usual, we value your feedback, your questions, and we are here for that specific reason, not just to enlighten you, but also to respond to your queries, your questions, and your doubts about this. So we have the expert himself here, and he is ready to take us through this conversation. Remember, our number is 0717-424-866. Drop your comments, your questions on our social media platforms, that is on Facebook and YouTube. So let's get started without wasting much time. First things first, let's start with the basics. What is epilepsy and how does it present itself in patients?
Yes, so epilepsy basically is a disorder where someone has seizures. So seizures are basically when part of the brain or the whole brain itself becomes overactivated. And then the patient starts, or the person starts having certain symptoms like shaking, fits, yeah, it can present itself in many different ways. But the main issue or the origin of the problem is overactivation of certain parts of the brain or even the whole brain in general. So we have seizures and we have epilepsy, and people use them interchangeably.
Are they different?
So basically, epilepsy is the disorder and seizures are the symptoms. So just like how we have pneumonia as a disorder, as a disease, and then coughing is like a symptom of pneumonia. So seizures are a symptom of epilepsy. There are many causes of epilepsy, and when you, and basically, when you have, to say someone has epilepsy, we say that they've had either 2 or more unprovoked, sudden, seizures. Yeah.
So now, besides the seizures, what other warning signs does epilepsy present?
Yeah, so there are signs that someone is about to have an epileptic attack. And so someone could actually have visual hallucinations or sometimes hear something before they have a seizure fit. But how do seizures present themselves? They usually, commonly, people recognize seizures when someone basically freezes, they don't respond to their name, they fall down, they start shaking, they can actually become so stiff, then they start shaking. And other times, even during the shaking fits, you'll see that they start foaming from the mouth, they can bite their tongue, they could have urinary incontinence, meaning they just urinate on themselves, or they can even pass stool. So those things can happen. Secretions can come out of the mouth. And so those are all signs, signs that someone is having an epileptic attack. Yeah.
So now, what is this disease burden globally and in Kenya and also across other nations worldwide?
So the disease burden, so seizures itself or epilepsy, it's quite common. It's one of the most common, or seizures are one of the most common neurological symptoms worldwide. And I think in Kenya, it's like the 3rd most common presenting symptom in a neurological disorder. Right after headaches and dizziness, people come with seizures when there's a neurological issue. It really spans globally. I think the lifetime risk of you having a seizure is 5%. So it's quite a common thing, and it spans on different types of. It spans across different fields of medicine. There are seizure disorders in pregnancy. There are seizure disorders in childhood, in children. There are seizure disorders even in adults who come in. And it can be caused by so many different things and so many different diseases. So the burden is quite a high burden.
Thank you very much, Dr. Khalid. Now, according to the World Health Organization, it is estimated that 5 million people are diagnosed with epilepsy every year. So that really gives us a wider picture of how risky this is and how it affects the burden of this disease. So we move on with the discussion. What are the major types of seizures? Do we have specific types? Do they vary in terms of severity?
Yeah, so that's a perfectly good question. There are many types of seizures, many different forms of them, but they can generally be classified into two main types. So we have something called focal seizures and generalized seizures. So focal seizures are basically when someone has a seizure that affects one certain part of the brain, yeah? Generalized seizures are those that affect usually the whole brain in general. So in focal seizures, where it affects only part of the brain, the patient can actually be awake, or the person can be awake and they can be responsive, but maybe their shoulder is shaking.
Just part of the body.
Just part of the body, exactly, is affected. But otherwise, they're conscious, they respond to their name. Sometimes they're even they're able to even have a conversation with you. But in generalized seizures, the patient is usually unconscious. They can't respond to their names being called. They can't look at you or respond to visual stimuli. So if there's even, let's say, a flash of light over here, they wouldn't turn and look at it because they're busy, having a seizure event. So in generalized, it affects the whole part of the brain, and usually the whole body is affected. That movement is everywhere sometimes. And there are different forms of them, of generalized seizures. So these generalized seizures can be, for example, generalized tonic-clonic, which is a medical term for when someone has stiffness for some time, then they start shaking everywhere. Another form is when someone has absent seizures. Absent seizures is something where it usually affects the pediatric population, children who are in school. And it's where now they stop, they can't respond to their name being called out, and they keep on blinking and staring straight ahead. They just blink and stare ahead, and they can't respond to their name. They can't, it's not shaking, but it's like they're daydreaming.
Oh, so they're not cognizant of their surroundings.
Exactly.
They cannot know what is happening around them.
Exactly. Okay. They don't actually. And you'll see the teachers calling them like, hey, wake up, but they don't respond. Sometimes it could actually be caused by a seizure itself. And it's a form of generalized seizure where it affects the whole brain because they can't respond to their name. And it affects like the whole body. Another form of a generalized seizure is something called atonic seizures, where basically all the muscles in your body stop working and you actually fall to the ground like you faint. And so you'll find that some people who have this sort of faints could be caused by different type of things, but when you do certain tests in the hospital, something we call, maybe we'll talk about it later, but something we call an EEG, you'll find that they're actually having a seizure attack when they faint. So, yeah.
All right, now, you mentioned oral secretions happens. Does this occur when the patient is having focal seizure?
That's a very good question. Not so often. That's not so common. We usually see foaming on the mouth when someone has a generalized seizure. And it's like secretions that come out, sometimes bubbly secretions that come out, sometimes vomiting. It's vomitus that actually comes out.
Can they bite their tongue?
In focal seizures, not so. It's possible if, let's say, the part of the brain that is affected in focal seizure is like, let's say, the muscles of chewing. It can happen where just the only part that's affected is the muscles that are involved with chewing, and then you bite your tongue, but you're still able to respond to your name being called out. If someone calls you, like, but you've bitten your tongue, it's possible, but it's not so common.
It's not so common, not even in general seizure?
Now, in general seizure, it definitely
It
is.
happens.
Yes, in general seizures, you'll have the patient is unconscious, they can't respond to their names, they can't look at you, they're just looking upwards. Their eyes may even roll backwards, what we call eye rolling. They can form secretions as they shake. They form secretions from their mouth. They can vomit. They can urinate on themselves. They can pass stool. So all those things can actually happen now most commonly in a generalized seizure.
All right. The common question that lingers in most of us, in our minds, especially when such symptoms happen, is what really is the precursor? Is there an underlying condition that is leading to the seizure? Or is it hereditary? Or what exactly are the causes of epilepsy?
That is a very good question. So epilepsy is a symptom. Seizures are a symptom.
Symptoms.
Just like any other, just like coughing. So the causes of seizures can be so many, and we usually group them into certain categories. So for instance, there are vascular causes of seizures, which just means disorders of blood flow or blood or vessels. So someone with a stroke, bleeding into the brain, or a clot in one of your blood vessels to the brain can cause a seizure. Even things like idiopathic causes. Usually idiopathic causes are unknown. It just means unknown. So you'll find most of the time the cause is unknown, and in those cases where we don't know what the cause is, you'll find that there's a genetic pattern. You find there's actually a family history of epilepsy or of seizure disorders. Even autoimmune diseases can cause seizures. Autoimmune just means these are diseases where your immune system attacks itself. And you've heard probably of lupus. Someone who has lupus, SLE, what we call SLE. SLE just stands for systemic lupus erythematosus. And you'll find that their immune system attacks different parts of their body, their kidney, their lungs. It can also attack your brain. So when your immune system, now in those conditions where your immune system attacks your brain, it can damage certain nerves, certain areas of the brain, and that can cause now seizures, And apart from that, even metabolic causes is a very common cause of seizures. Metabolic causes include things like low glucose levels. Actually, you'll find that most of the patients who come into our accident and emergency center and they're having a seizure fit, you'll do a blood stick glucose, you'll check their glucose levels, and you'll find that it's very low. So hypoglycemia can actually cause seizures, and you'll find that diabetics who probably overdosed on insulin, blood sugars became very low, or they missed their meals, they'll end up having like a seizure, and you'll find the main cause is hypoglycemia. Other metabolic causes include things like low calcium levels, hypocalcemia, low sodium levels in your blood, hyponatremia. All those can actually also cause seizures. They can actually cause seizures.
Can drug abuse and alcohol misuse lead to seizures or be a precursor for epilepsy?
Absolutely, they can. Drug abuse can cause seizures. These drugs include things like alcohol, like you've mentioned. Alcohol usually depresses the brain. So if someone takes alcohol chronically for such a long time continuously, and even in a great amount, when they stop, usually in withdrawal, when they stop taking alcohol, you'll find that their brain becomes overactive more than usual, and they end up getting seizures. And so that can happen. Other drugs include things like stimulants like cocaine, and those drugs could actually also cause seizure fits as well. But
And is the condition hereditary?
Yeah.
Can someone is the risk of someone contracting this disorder higher if maybe they had somebody in the family lineage who had it?
Absolutely. Yes, in fact, you'll find that, like I had mentioned before, certain patients who get, who we cannot find the cause of the seizure, the specific cause, you'll find that they actually probably have like a strong family history of it. For instance, true. And there's some genetic diseases also that can cause epilepsy. So you'll find there's some, for example, children who have like or maybe some children who have like a family history of brain tumors. Tumors also can cause seizures, especially tumors in the brain. And so, so it's possible that someone may have a family history, and there's some research coming out that shows a link between certain genes or genes or in genetics that are linked to seizures. But like I had mentioned, even tumors can be hereditary, and you can also get a seizure, from tumors. There is something I also forgot to mention that is a very important cause of epilepsy, and that's infection. So you'll find certain infections can cause seizures, and this includes things like meningitis, which we've all probably heard of before, even at home. And so meningitis is basically when you have inflammation of the covering around the brain, and sometimes even the brain itself, what we call now meningoencephalitis. And it can be caused by viruses, bacteria, even certain fungus, and even malaria itself. Severe forms of malaria can affect your brain, and you can get seizures. So
speaking of the causes, there are so many myths or misconceptions surrounding this, especially when someone starts getting or having the seizures. So many people link or attribute them to a curse or a possession by evil spirits, especially in the African context.
Yeah.
What's your take about that?
I've heard of that before, where someone would, especially in rural settings, where you'll find a child would have a seizure, and then the family or even an adult will have a seizure, and the community will presume that it's because of a witch doctor or a curse that's been inflicted on them. I don't think that's so true. It's always good to come to hospital, or if you know someone who does have a seizure in the community, it's always good to bring them to hospital so that we can further evaluate and run some tests and see what could be causing them. But the fact that it's caused by like magic, or I don't think that's true.
That takes us to another question. When a patient comes and they are having these seizure symptoms, how do you diagnose epilepsy?
That's a very good question. So when a patient comes to the hospital and they're having a seizure fit, let's say the most common generalized tonic-clonic, where their whole body is just shaking, you know those ones, foaming of the mouth, the way we described before, we'll do certain tests to rule out certain things, those causes that we talked about. So some tests we can do is a brain scan. We can do something called a brain CT or a brain MRI. So in a brain CT or a brain MRI, we look for things like a stroke, bleeding in the brain, which we talked about. We can look for tumors, space-occupying lesions, meaning things that occupy space in the brain, like cysts, There's abscesses. Some patients can have abscesses, just like we have an abscess on your skin, basically a collection of pus. You can actually have a collection of pus even in the brain. Oh. Yeah, it happens in patients with low immunity, like patients who are on anti-cancer medications, or patients who may be HIV positive. It's possible that you can develop certain brain opportunistic infections that can affect your brain, like toxoplasmosis and other abscesses. So we do a brain imaging, CT scan or an MRI to check. If we find that there's nothing, which can be very common, you'll find that a patient with epilepsy doesn't have anything on a scan, we'll take some blood. We'll look at your electrolytes, just like we talked about those metabolic causes of epilepsy. So we look at their sodium levels, we look at their glucose, we look at their calcium levels. Yeah. So we also can check for malaria. We screen for malaria, because you'll find that for severe forms of malaria that cause abdominal pain, diarrhea, you can also get cerebral malaria, which is now when the parasite actually infects the brain or affects the brain. So we'll screen for malaria too. We'll also do something called an EEG. So an EEG is a term. It's a shortened term, but it basically is an electroencephalogram. We just shorten it. We say EEG, but it's where we take you to a certain place, or we use a machine that has electrodes, which we put electrodes, meaning like basically certain wires that we hook on different parts of your brain, and then we examine, we see how your brain, the machine actually has, it prints out, when we put those wires on your head, the machine prints a waveform.
You are able to see a clear image of the internal brain?
Yes, you're able to see how your brain waves are, how your brain wave patterns are. So we'll see how your brain reacts when you're actually having a seizure there, or just generally, even while you're sitting down, we see how your brain wave patterns are. It can tell us if this patient has features of abnormal brain waves, typical of seizure disorder, or if a patient has epilepsy. Some EEGs are so specific, they can even tell you if it's a focal type. Yeah, but so those are generally the tests we do.
Thank you very much, Dr. Khalid. And my director says it's time to take a break. Remember, you must be asking yourself, can you live a full normal life when you have epilepsy? We will be discussing that shortly after this break. So, and of course, many more, including the treatment modalities available, prevention measures. So do stay with us. We'll be right back in a short while.
Capuchin TV, your Catholic broadcasting ministry. Catherine Macaulay Nursing School is a leading institution in Kenya offering competitive training in nursing professionalism.
We are a nursing school that was started way back in 1972, chartered as a midwifery school. The school is run by a highly qualified faculty. All the departments, for example, you look at midwifery, it's headed by someone with a PhD in midwifery. Critical care is headed by a highly specialized person with a master's in critical care. Nephrology, the same. Our clinical instructors for these programs are also specialized in their various fields.
The school is licensed and accredited by the Nursing Council of Kenya to offer holistic training in various nursing programs.
We have general nursing, that is the Kenya registered nurse. We have higher diplomas in Kenya registered midwifery, Kenya registered critical care nurses, Kenya registered nephrology nurse, and also we have theater nursing, which is called Kenya registered perioperative nursing. We do admit our students from all over the country, especially for the basic diploma, that is the Kenya Registered Nurse Program. And for higher diplomas, we admit, again, we have a Pan-African presence. We have students from Congo, from Rwanda, from Uganda, and from other countries. But basically, most of our students are Kenyan, those ones who have graduated from our Kenyan institutions.
Enjoy your learning in a friendly environment with adequate training facilities, including a fully fledged skills laboratory, library, lecture halls, and accommodation amenities.
We have good facilities for our training. We have a very well equipped skills laboratory. This is for all the programs, both the basic diploma, the Kenya Registered Nursing, the midwifery, the critical care.
Nursing is a noble profession because we work with our clients at different stages of their lives, right from birth up to end of life. When a baby is born, a nurse is present. When a baby is brought to receive vaccines, a nurse is present. When you fall ill, the nurse is by your side. And even at the end of life, a nurse is present. So we are there to give our services throughout each stages of human life.
For more information, call us on 0732 163 164 or 0719 073 164 or visit our website at www.materkenya.com.
Capuchin TV, your Catholic broadcasting ministry.
All right, welcome back, dear viewer. We are glad you're still keeping us company, and this is Health Discourse on Friday. As usual, we bring you this discussion just to enlighten you about different medical conditions, how best you can approach them, at what point should you seek medication, and how best to prevent them. So with me in studio is Dr. Khalid Abdallah from MATER MISERICORDIAE Hospital, and this is our second session. We are discussing one of the most common neurological diseases globally, that is epilepsy. It is a disease that is surrounded with a lot of myths and misconceptions, especially superstitions in the African context, and we are just trying to demystify some of this as we take you through this condition to enlighten you more about how it presents. And before we went for a break, we were trying to understand how it is diagnosed, and you had it from the expert himself. So as I promised, when we come back from the break, we'd be getting to know if you can live a normal life if you have epilepsy, if you are diagnosed with epilepsy. Keep your questions coming and your concerns, and I'll be sampling them as soon as I receive them. So welcome back, Dr. Khalid.
Thank you so much.
Okay, so this question is something that always, that will always come into your mind, especially as a patient when you're told that you've been diagnosed with epilepsy. You're like, now is my life shattered? Will I lead a full normal life like any other person? Are some things supposed to change? How does it happen? How is this case with patients with epilepsy?
Yeah, a lot when people are diagnosed with epilepsy, they can actually think that that's it, their life is done, and that's not true. A lot of people who are diagnosed with epilepsy will end up having or even a seizure disorder, will live a very normal, fulfilling, good life.
Can they do things like driving, cooking, staying in the house alone, just chilling?
Yeah, so if you're driving, there are certain different countries have different rules and regulations when it comes to something like driving. So you'll find there are some countries where the law is you must have, or the rule is you must have at least 2 years of seizure-free life, whether you're on medication or off medication, for you to be given a driving license. And even then, you'd have to have someone accompanying you. Cooking is fine. You can cook. But if you're using a knife, you have to take precaution, or at least have someone there with you, so that. Try not to actually what I would recommend is, if you're doing some risky type of activities, you could let someone else help you. So if it's something like cutting or cooking in the kitchen, let someone assist you in doing some of those risky things like chopping or things like that. But otherwise, if you're going swimming, I'm not sure if we've already talked about that, but if you're going swimming, if you're going fishing, make sure someone is there with you, so that in case you need, they need to assist you or rescue you, they'll be there. As long as you take your medications and you go for a regular follow-up, you can actually live a very good life. Some occupations, some types of jobs may be restricted for patients with epilepsy. You'll find that they may not allow you to do things like become a pilot, flying a plane, or jobs like that. So, but there's still so many other things a person can do.
Okay, so now what should someone do when they find a person having seizure at home or in public place?
Yeah, so if you see a patient, if you see someone having a seizure at home or in public, the steps that you should take is more or less the same. A lot of times, I'll find most of my patients' family members will see their loved ones having a seizure and just panic and not know what to do, and even cry. But
absolutely, especially.
That's one of the commonest things I've seen. They just cry and shout for help. And one thing you should do is just remove the patient from the area of danger. So that's the first thing you should do. If they're having the seizure, they've collapsed, they're having a shaking fit, just move them if they're close to a place where something bad could happen. Say if they're in a public place, if they're on a hill and they might fall off the hill or a cliff, drag them away from that area. Or if they're at home and there's like a stand or a TV that might fall on them, move them away from there. And then the next thing you should do is check their airway. Just make sure that there's nothing in their mouth that could choke them, like gum or something like that. But don't put anything in the mouth. One thing I've also heard is, or a common thing I've seen is, putting things
to prevent them from biting
their tongue. You know what? That is wrong. That's actually completely wrong. Do not do that, because you'll find when a patient is having a fit, if you put a spoon, say, in the mouth, you could actually cause more injury to them, because they would bite the spoon, and it can even mess up more things, cause more damage in the mouth.
What about a soft material like rubber or?
Still don't recommend, because if you put rubber, they might swallow it. They might inhale it and choke. If the patient is having a fit, allow them to finish their fit. Just let them finish it. Don't put anything. Some even put their fingers in the patient's mouth or in the person's mouth just to prevent them from biting their tongue. You could even injure your own fingers. They could bite your fingers and you could be injured yourself. So the best thing to do is let them have their fit there and then, let them finish their fit, and then when they're done, put them in recovery position, which just means tilt them to their side, put them on their side, so that if there's any drainage or any vomitus, it'll just come out and they won't choke on it. And then you should stay with them until help arrives. You call the hospital, or you call an ambulance or any sort of emergency number, and let them come to you, but you stay by their side. Don't leave them alone, because you need to make sure you're there if they have another fit. you need to see what kind of fit is going on, because like we said, in generalized seizures, the patient isn't awake. They won't know what happened to them. Sometimes even when they wake up, you'll find they won't even remember.
There are people who prefer to wait for the patient to regain consciousness. Would you advise that?
As in to wait to regain consciousness before calling? You could actually, I think it would be okay to call even while the patient's having a seizure, so that when they're, or even if they have a seizure that lasts less than 5 minutes, and they regain consciousness, you could just take them to the hospital yourself. But sometimes seizures can last for more than 5 minutes, even more than 30 minutes. That's something we call status epilepticus. And so in those cases, let's say you're over there, you're letting them finish their seizure, but it's lasting more than 5 minutes, call the emergency immediately, let them come. Don't even wait, let them come, because if the seizure is lasting so long, you may need emergency drugs that stop the epilepsy there and then. So, so in terms of waiting until they regain consciousness, I feel like if they're unconscious, it's a good idea to go to hospital.
It could get risky, okay? Yeah. All right, now, now when this person has already have that seizure and they've regained consciousness, is it okay if can they like seek medication by themselves, or they have to be accompanied by someone? Is there a likelihood that it can occur again on their way to hospital or a medical facility?
It's possible. It's possible that after they've regained consciousness, even on your way to hospital, they could get another seizure. I don't recommend that someone just has a seizure and then goes to over the counter to get medications or to try treat the seizure themselves, because you wouldn't know what's causing the seizure. And also some of these medications that are used for treating seizures, you can't even get them without a prescription. Or and even most of the public don't know what kind of medications you can give. So it's always encouraged that you go see a neurologist or you go see a neurosurgeon that can help with what's going on. Accompanied by someone. Accompanied by someone.
Oh, thank you very much. Now, what this condition, epilepsy, how lethal is it? Is it curable? Is it a lifetime condition?
Like we had mentioned earlier, there were many causes. So some of the causes can be controlled with just medications, and some of the causes can be controlled by, can be cured by other means. Like can be not cured. When we say we're treating epilepsy, those that are treated with medications, they don't necessarily cure you from epilepsy, but they just control seizures.
It's just managing the condition.
It's just managing the condition. But there are some causes of epilepsy or seizures, seizure disorders, that could be, say, cured, like a tumor. If you remove that part of the brain that's causing the seizure, you could actually, potentially the patient could not have a seizure event again. Okay. But in terms of treatment, when you go to a neurologist, and even at MATER Hospital, there are neurologists for children and specific neurologists for adults.
So what are these treatment modalities, options available?
So the treatment options include drugs called anti-epileptic drugs. So for anti-epileptic drugs, we start off with one drug for the patient, and we give them at low doses. Then we gradually increase them with time until we find that the patient is now not having any more seizure fits. If that doesn't work, sometimes patients will still have seizures. We'll add a second drug and reduce the first one, and then gradually reduce the first one that we gave. If the second one is still not working, we could give two at the same time. If still that doesn't work, and that can happen in like 30% of patients, where it's seizures that don't respond to medications at optimum dosages, there are other forms of treatment. There's surgery, like we talked about just a few minutes ago. where you remove certain parts of the brain that causes the seizures. There's also something called vagus nerve stimulation, where you put a device under the skin, on the chest area, that actually activates a nerve that goes to the brain. It's called the vagus nerve, and it helps relax the brain and prevent seizures from happening. I don't know if that is done so much in Kenya, but it is an option that's available out there. There's also some research that shows that certain diets help prevent epilepsy. Keto diet, I don't know if you've heard of it, where a person is taking high fats but low carbohydrates, low calories. Some research shows that it also helps control seizures. So there's many treatment forms.
Do you treat the symptoms? Because you mentioned some causes, including brain tumor, malaria, and some infections. So when after diagnosis, do you treat the symptoms that cause the seizure?
Yeah, what I've talked about just now is, especially when it comes to epileptic medications, those are for people who we don't know the specific causes, and we now say they have epilepsy. But if we do diagnosis and we find out that your seizure is caused by an infection like malaria, we'll give you medications for that. If it's caused by brain abscesses, we'll drain the abscess. Surgery may be done to remove the abscess. We give you antibiotics. So if we know what the cause is, if it's because of hypoglycemia, we give you sugars. We give you, we replenish your low sugars. So definitely, when we diagnose you and we find out what's the cause, we treat that instead of giving you now anti-epileptic medications. Because just because you've had a seizure does not mean that you have epilepsy. Remember, epilepsy is when you have 2 or more unprovoked seizures, and most of the time they're not just curable.
In a day? 2 or more in a day?
Actually, it can be 2 or more, not just in a day, just two seizures in 2 different events, like 2 different events. It doesn't matter about the time.
Different contexts?
Yes.
Okay.
As long as it's unprovoked, it doesn't happen because of low sugars or because of, a fever or because of alcohol intake and alcohol withdrawal. So long, that's now when we just treat that's now when we say you have epilepsy. Yeah.
So people who are on other drugs, say for instance they are diabetic patients or HIV positive, or they're using contraceptives, can that affect the effectiveness of the drugs or the treatment administered to them for epilepsy?
For epilepsy, yeah. Those anti-epileptic medications, they can affect when we're choosing them. That's why I say you should always go to a neurologist if you find that there's someone who has epilepsy, or someone who has seizure disorders, because there's a whole list of different types of medications for epilepsy you can give, but they all have their different side effects, and some can be used for this, some can be used for that. So when it comes to contraceptives, women who are on there's some anti-epileptic meds that can actually reduce the amount of contraceptives in your system. They can flush them out quickly. So there are others that they would give you to stop that from happening. There's some drugs that we don't give for women who want to have babies or for pregnant women, because you'll find that they can cause harm to the baby. They can cause birth defects to the baby. They can even cause the baby to have seizures when they're born. So,
in such a case, do you delay treatment, or there are different kinds of medicines that are not so harsh on the baby?
Yes, they are. There are different medications we'd give you specifically for pregnancy. And there are medications we'd give you specifically for a lady who is in childbearing age and you're planning on having a baby soon. We'd give you specific meds that control epilepsy and won't prevent you from having problems during your pregnancy.
So most of these drugs, the anti-epileptic drugs, can affect the reproductive system or fertility?
They not necessarily. They can't cause infertility, but what they can cause is basically problems to your baby if you do get pregnant. So if you are a young lady and you're in a reproductive childbearing age, we give you some medication so that in case you get pregnant, it won't affect the baby you'll have. And even for school-going children, children who have epilepsy and they're going to school, or teenagers who are doing their exams, there are some medications that can cause drowsiness, sleepiness, reduced concentration. So we'd give you medications for epilepsy that actually don't affect your performance in school. Don't reduce your performance in school. So it's always good to come and see a neurologist in the hospital so they can give you the appropriate medications. Yeah.
Thank you very much, Dr. Khalid. Now, in every situation, we always encourage to be safe, to try and prevent this condition. Of course, when it happens, you've got just to seek medication, but it's always wise to try as much as possible to prevent this. So what are some of these preventive measures for epilepsy?
Yeah, so there are many ways you can prevent seizures or epileptic disorders. So one thing is, if you've already been diagnosed, make sure you take your medications every day. Try not to skip days or get lazy and miss your medication. So so just make sure you're continuously taking your medications. Apart from that, also for there are some seizure diseases that occur for women who are pregnant. So make sure you go for your something we call preeclampsia, where pregnant women with high blood pressures will have seizures, can actually have seizures. So make sure you go for your antenatal clinics. You see your doctor regularly. They do checkups. If you do have epilepsy also, make sure you also go for follow-up clinics.
And maybe some of the health practices that can keep this condition at bay?
Exercising also helps. So there's a lot of misconception where some people say that, oh, you shouldn't exercise, it might trigger you to start having a seizure fit. In fact, that's not true. Exercise is something that also helps when if you don't have seizure disorder. It improves your physical and mental well-being. So you'll find that exercising also helps patients with epilepsy. It prevents them from having other seizure attacks. So that's one thing that someone can do. Eat right, eat healthy. Make sure you're not hypoglycemic. If you're diabetic, you take your medications correctly. You keep at your meals the way it's supposed to be, so that you don't have hypoglycemia.
All right. Yeah, okay, so now briefly, because our time is against us, but we still need to know, can epilepsy degenerate into other little diseases or disorders in the body? So epilepsy can't really cause other lethal issues, but when we mentioned earlier, if someone has prolonged seizures for more than 30, it can even happen more than 5 minutes, even more than 30 minutes, that can actually, they are at risk of actually having other complications, coma, or even death. So it's always good if someone has a seizure for more than 5 minutes, call an ambulance, let them go to hospital immediately. Otherwise, some other causes of seizures could risk them having an issue. And finally, as we wind up, there's this myth that when someone passes out urine when they're having seizure, when you get any part of your body gets into contact with that urine, then you might really contract or get epilepsy?
Oh, so that's
Is
also
that founded somehow?
that's definitely a misconception.
Okay.
Because epilepsy is not contagious, it's not communicable. Just if you touch someone's, let's say if somehow the urine gets on you, doesn't mean you'll get epilepsy or you'll get seizures. It's a disease that can't be transmitted. Yeah.
Thank you
So,
very much.
yeah.
Your parting shot to our viewer today about epilepsy or seizures?
So what I can say in summary is that there are many causes of someone who has a seizure at home. And if you do see someone having a seizure, you should know what to do and bring them to hospital so that they can be followed up and investigated so that we can know how to treat them better. Don't fear this thing. It's not something that is scary. You should actually just, as long as you know what to do when someone is actually having a seizure in front of you, bring them to hospital and we'll take care of them from there. So, yeah.
Absolutely. Thank you very much, Dr. Khalid. We really appreciate your time and your insights on this. I know it is a really broad subject, and
really
would have really discussed more about it, but time is against us.
I understand, but
Thank
it's been
you very much.
Yes, no problem.
Thank you very much for making time for this.
It's a
All right,
pleasure.
that is Dr. Khalid Abdallah Muhammad from MATER MISERICORDIA Hospital today, and he was here with Dennis Ngetich, and I would really appreciate your efforts and your time, and most importantly, the information that you have shared with our audience. I believe you've learned something from this, and I'm glad that you've been with us. You've been keeping us company since we started, and right now we have to wind up this subject. We will meet next Friday. Our camera operator has been Alan Andiva. Our audio on the audio desk we had Kevin Kitavi. The visual mixer had been Michael Ndegwa, and we also had Michael Kibandi on the transmission desk. And all right, remember to keep healthy, be safe wherever you are. My name is Sasha Elizabeth. See you next time. Goodbye.
Medical center was opened about slightly above 10 years ago, and since then we've been providing ambulatory.
Welcome to MATER MISERICORDIA Hospital, Nairobi CBD Medical Center.
Development House Medical Center was opened about slightly above 10 years ago, and since then we've been providing ambulatory care to clients who come to us. The clinic is located between Tom Mboya Street and Moi Avenue, right opposite the Pioneer Building.
We guarantee our patients quality standards and variety of medical services.
At Development House Town Clinic, we have the following services. We offer doctor's consultation. We also offer physician services on Mondays and Fridays, obstetric and gynecologist services on Wednesdays and Saturdays, nutritional services on Fridays. We also have a well-equipped pharmacy, a well-equipped laboratory. We have physiotherapists, and we also have just begun our wellness services as a way of encouraging preventive medicine.
We provide specialized services, that is gynecology and antenatal clinics. We provide services to the diabetics and the hypertensive patients. We give nursing services. We will do your dressing, we give you injections, we also provide some counseling services. We have specialized counselors that would give you natural family planning counseling and guidance, and you'd also get the general counseling. We also provide adult immunization, and basically for adults who want to travel, we are able to give you the vaccines that you need.
We uphold the dignity and privacy of our patients as we strive to meet your healthcare needs holistically and in a more compassionate way.
The service that you'd receive at our medical center is a value with a touch of Christ. We do not just want you to be taken care of physically, but you also think about your spiritual care and spiritual growth.
Visit us every Monday to Friday from 8 a.m. to 6:30 p.m. and every Saturday from 9 a.m. to 3:30 p.m. and get value for your money.
We ensure that you're seen within the shortest time possible, however, providing quality care.
I welcome you all to MATER Hospital CBD. We assure you of timely, efficient, and satisfactory services.
MATER Hospital welcomes you to its newest satellite medical center at the Well Mall along Langata Road in Karen.
The reason why clients should come to MATER Karen Clinic or Medical Center is because we offer a variety of medical services to include consultation services which are done by our qualified and experienced doctors.
We manifest the Spirit of Christ in the provision of healthcare to all our patients as we adhere to the values of the Religious Sisters of Mercy.
We provide basically primary healthcare services. So this means we'll follow up patients on an outpatient basis for various diseases, including diabetes, asthma, and any other illness which arises, which does not require complex care. Our staff are qualified and provide effective services which are cost effective and good for our patients.
The various services that we offer at our clinic include pharmacy services, where we have a fully stocked pharmacy run by a qualified pharmacist, and we serve all your prescription needs. We have laboratory services that are run by our qualified lab technologists.
Get more than just basic treatment at MATER Hospital Karen Medical Clinic.
One of the key features of primary care is that we provide health education about various conditions. This would include things like hypertension. We would advise you on things such as how to take care of your health.
We serve our clients within a very short time. We have enough well-ventilated waiting area for our clients. And we have rooms for all those procedures that we've mentioned, well-spaced rooms with enough facilities and equipment. We also have all the decentralized services that are offered from the main hospital, to include ultrasound services that we offer on Wednesdays from 8 a.m. to 5 p.m. in the evening. So feel welcome to MATER MISERICORDIAE Hospital, Karen Medical Center.
We take pride in your wholesome well-being. We are always ready to meet you at your point of need.
A lot of health issues are now preventable, and this means that just by making lifestyle changes, we can improve the health of people in the community.
Our esteemed clients and patients, welcome to the MATER MISERICORDIAE Hospital, Karen Medical Center.
We have a large, well-ventilated facility, which means that we are able to see patients in a safe environment. And I would ask you, if you have a health issue and you are within the area, please feel free to come and consult us. We're happy to work with you and identify your issue and resolve it.
We are open every Monday to Friday from 8 a.m. to 7 p.m. and every Saturday from 8 a.m. to 5 p.m.
You come and support us in this medical clinic in Karen, in the well. We are in the first floor. And you just test us. Sisters of Mercy are known for quality because they are all over the world, and especially our care for the sick. It is hard times because of the coronavirus, but we know we will give the best quality.
We just want to welcome all of you to come to our gynae clinic. It runs every Tuesday from 9 to midday. We have the full gynae specialty, all located in one room, one roof. We have a very comprehensive lab. We have ultrasound services, and most of all, we have caring staff who are going to take care of all your needs. So once again, welcome and karibu to this great medical center of ours.